Welcome to Variations 4, the genital urinary unit. And in this video, we're basically finishing up the unit, covering question 6 through to the final question, question 11. And it's a lot of kind of small topics, or at least we just touch on a bunch of topics. And so we just call this video Miscellaneous GU Topics. So the first topic is on basically the management of pyelonephritis. So what is that? And how do we manage it? So the renal pelvis is down in here. As you can see, pyelonephritis is inflammation of this area. So it's inflammation of this area of the kidney. And as you can imagine, there are a number of things that could cause this inflammation. They're listed all up here, and hopefully they make sense. You can add these to the list. They weren't up here for some reason. There's all these can cause, these are kind of infectious processes. But of course, anything that causes reflux or urine to go backwards from the urethra up into the kidney can also cause inflammation. And that's why these things are here. And the cortex becomes inflamed. You get these symptoms here, this whole list here. It's kind of non-specific. You would have to do some diagnostics to figure out what's going on. And you've got some visual diagnostics like an ultrasound. You've got some laboratory work like urine samples, urinalysis, where they count the amount of cell debris and white blood cells and kind of tells them how the kidney's functioning. In terms of treating it, you may need some kind of antibiotics. You may need to flush things out with fluids. And even though NSAIDs are controversial with kidneys in general, especially if there's kidney disease, you might need some to counteract the inflammation. That's going to be a balancing act. That's a physician decision. If you don't deal with this infection, it can lead to septic shock. It can lead to permanent damage of the kidneys. That's pyelonephritis. Pyelonephritis, sorry. Let me try one more time. Pyelonephritis in a nutshell. The next question is about glomerular nephritis. The glomerulus, as you know, is the filtration portion of the kidney. If that becomes inflamed, you're going to, well, let's look at that. First of all, what can cause that inflammation? It could be a viral infection. It could be some kind of autoimmune issue. You don't need to know all this details about the basement membrane here. You just need to know some kind of infectious or immune disorder can cause inflammation of this tissue, and the rest of it becomes very similar to what we just discussed above. You've got these kind of non-specific symptoms here in the triangle. In terms of dealing with it, there again, you got some specific markers for lab work. You don't need to know too much about these, but yeah, you might just check for streptococcal antibody, certain levels of proteins, again, urinalysis, blood work, pretty general stuff. I don't need you to go into too much detail. There's always a biopsy might always help as well in terms of figuring out what's going on. In terms of treatment, the patient needs lots of rest. They need fluids. They might need diuretics. They might need antihypertensives. Why is that? Because if the glomerular is not filtrating properly, then fluid is building up in the body. Of course, for any kidney failure, you might need to adjust protein for what we talked about before in terms of urea buildup. And of course, antibiotics and corticosteroids, immunosuppressants in some cases. Here below explains what we mean by complement proteins. It's part of the immune response. But in general, it's pretty generic stuff in terms of the infectious process. The next question asks us to deal with urinary tract calculi, or Gall Stones, basically urolithiasis, if you want to get fancy. There's lots of things that can cause these. You don't have to have an in-depth understanding of these really. But the sedentary lifestyle, as you know, increases calcium in the bloodstream, and that can increase stone formation. In a nutshell, dietary factors can, like too much protein, too much, yeah, dietary factors can basically increase your chance of gallstones as well. We don't need to get too much into that. Hot climate, which can increase dehydration, thereby increasing concentration of electrolytes, can contribute to calculi formation as well. I don't need you to know a whole lot more detail about that. This whole thing about oxalate level, and it's dietary. Basically, yeah, so these are contributing factors to the stones forming. In terms of, interesting to note, calcium intake is not a clear factor. It's more of these other things up here that I just talked about. I don't need you to go into much more detail than that. Basically, the clinical manifestations of this is going to be don't worry about these different places of obstruction. It really doesn't matter. Basically, it's the fancy names. I mean, basically the stone, what you want to know is the stone could be in the ureter. It could be moving down the ureter. It could be in the the urethra. Whether it's in the ureter or it's in the urethra, it is incredibly painful. This is going to be a huge thing, is dealing with the pain. Sometimes the treatment is just for the patient to pass the stone. That can be incredibly painful. Sometimes what will happen is they will do the lithotripsy. I've got them listed over here, which is the sound waves to break it down, but they still have to pass it. And sometimes they'll get surgical, which I don't think is incredibly often, but sometimes they'll actually do surgical removal of the stones. So, looking down the right side of this diagram, hopefully it makes a little bit of sense if you think about calcium deposits and this, the stone, which has calcium deposits in it. How do we kind of flush this out, and what are some of the symptoms, and how do we diagnose it? All those questions are kind of looked at here. This is IVP is basically a pyelogram. It's basically an imaging to look at to see where the stone is at. You might have to send a little scope up there to take a picture or to remove the stone, so up the urethra. And patients may have a nephrotube, a tube going in. Basically, if the ureter is blocked, they may need to put a drain directly into the kidney. So you have a little drain coming out the patient's back because the ureter is blocked. And so the patient might have a Foley bag coming out the urethra, and they might have a nephrostomy, a little drain coming out of their flank region, draining the other kidney directly because the ureter is blocked. I guess if there's any other questions about these you can ask. It's kind of a summary of what we said above. Yeah, basically, again, a summary: managing the pain, flushing out minerals. Catheter care is important because infections can change the pH and can contribute to the formation of stones. We've talked about scopes. We've talked about the nephrostomy tube. We've talked about the possibility of surgery, sound wave management, lithotripsy. Just kind of shifting gears here, kidney cancer. Sometimes people need their kidneys removed or one kidney removed. You can certainly operate with one kidney left. It's possible. And I believe our final topic here, and we're not really going into much more about that because we're not really talking about cancer in this unit. It's just a kind of a quick terminology overview. But bladder cancer, we see people with part of their bladder removed or the whole bladder removed. If it's only part of the bladder removed, they're going to need to have lots of hydration to prevent clots building up in the urethra post-operatively. And we're going to talk more about that in I&P when we cover continuous bladder irrigation. But finally, if someone has the whole bladder removed, which is quite possible, they'll have what's called an ileal conduit. And let's look at a picture. Let's finish this video off with a picture of an ileal conduit and just describe what is going on. So let's take a look at that. So this person's had an ileal conduit. What they've done is they've removed what used to be the bladder there. They've taken a piece of the ileum, totally removed it, a piece of the ileum, and made a pouch. So this is now no longer part of the intestinal system. They've made a pouch out of the piece of the ileum, and they've attached the ureters to the pouch so that the kidneys drain urine into this created pouch, and they've brought the pouch through as a stoma to empty urine out. So it looks like, to look at it, you would think that's a stoma from the GI system. It looks exactly like it. After all, it's a piece of ileum coming through the abdomen, just like an ileostomy, except this one is draining urine. And here you can see someone with the urostomy, or sorry, with the ileal conduit right here. Looks like a normal stoma, but it's actually urine coming out.